When do you need to have ear tubes? In 2022, the American Academy of Otolaryngology published clinical practice guidelines which set standards for patient selection and indications for having ear tube surgery done. This is based on a systematic review of the highest quality research available and, importantly, an assessment of the risks and benefits of therapy alternatives if you're having ear infections. They make two recommendations for when you should have ear tubes. The first is if you're having recurrent acute otitis media, which is a fancy way of saying a bunch of ear infections. Specifically, 3 ear infections in 6 months or 4 ear infections in 12 months, one of which has to be within the last 6 months. And at the time of assessing for ear tube candidacy, you have to have evidence of fluid in your middle ear space, which is right behind your eardrum. Sometimes in the office you can see the fluid. Sometimes you can do a pressure test called pneumatic otoscopy in the office, or you can have a special type of hearing test done called a tympanogram, which can document the fluid as well. The second recommendation for ear tube candidacy is if you're not having infections per se, but you do have fluid trapped behind your eardrum for 3 months or longer. This is called otitis media with effusion. And this situation has to be associated with documented hearing difficulties. There are 2 softer indications: 1 if you're at high risk, or 2 if you have chronic fluid in your middle ear space associated with symptoms, not necessarily hearing loss.